Meet 31-year-old Anand Patient Asabia, a young woman whose dream of becoming a fashion designer was shattered when she was diagnosed with kidney disease 4 years ago. After a life-saving transplant, she now relies on expensive medication to prevent organ rejection, placing a huge financial strain on her family. Like many kidney patients in Ghana, she faces the high cost of kidney treatment, with dialysis, essential for survival, being unaffordable for most.
What we want the government to do, we know they are able to assist us, the patient. They should try as very much as possible to help us to pay for our dialysis, because sometimes even to do one session in a week, it's very difficult. Imagine you've not urinated for 3 days or 1 week. Imagine how it is.
According to the 2010 Global Burden of Disease study, chronic kidney disease (CKD) rose from the 27th to the 18th leading cause of death worldwide between 2019 and 2010, second only to HIV/AIDS in its rates of increase. Over 2 million people rely on dialysis or transplant to survive, yet this represents only 10% of those in need. Globally, 5 countries, the US, Japan, Germany, Brazil, and Italy, provide treatment for most of the 2 million patients with kidney failure, leaving developing nations like Ghana with minimal access to care. The president of the Renal Patients Association of Ghana, Kojo Bafo Ahinkra, highlights the growing challenges of kidney patients.
We have medications that we take. We have other injections that we take. But that one, the health insurance does not cover. The health insurance only covers for the dialysis. So that is why I was saying, we wanted to meet the new minister and have a discussion with him. If they can put the injection and some of them, because the medications are very expensive. Our BP drugs are very expensive. The injection that we take every day, one of the injections that you take, it will cost you roughly about 2.5 to 300, and you need it every week.
For patients, every day is a battle between hope and fear. Despite her struggles, she remains determined.
To raise that 491 to go and pay for a session, I go on Tuesdays and Friday to go and pay for a session. It's very hard. It's like a whole project. Call a few people. Oh, please, can you give me 50? Can you give me 100? Can you give me this? Can you give me? Then you gather all together. Then you go and pay. It means the day you don't get it, you don't go, you stay home.
A 2023 study led by Dr. Elliot Korantin-Tano exposes a grim reality. Over 90% of Ghanaian kidney failure patients who need dialysis are denied access. The country's dialysis prevalence is just 38.8 patients per million, far below the average for low and middle income nations, 68 per million. Healthcare advocate Dr. Samuel Frimpong of the Private Health Facilities Association of Ghana warned that kidney disease is on the rise due to lifestyle factors.
Galamsey is giving us an issue. Our eating habits is giving us an issue. Those who smoke and eat at night, where they give a lot of pressure. Those who drink alcoholic, hard liquors, they are giving us a lot of issues across the country. So we need these educations as you are celebrating the Kidney Day.
Global estimates suggest that Ghana should have around 15,400 patients requiring dialysis. However, the current number of patients receiving dialysis is 1,195, just 7.8% of the estimated demand. The rest, over 90%, are left without care. Not wanting her daughter to be part of the cohort without treatment, patient's mother, Mercy Otubia, appeals for support for her daughter.
The situation gets worse every day. We are going through a lot. We always have to rush her to the hospital anytime she becomes sick. Our top priority is financial constraints. Consistently calling on people for help becomes a problem for us. We are pleading with government to come to our aid.
Over 80% of kidney failure patients receiving treatment live in affluent nations with universal health care. In developing countries like Ghana, dialysis centers are overwhelmed, operating at or beyond capacity. The median number of patients per center is just 20. Dr. Frimpong warns that if this trend continues, more lives will be lost.
If we accumulate this for a month, for 6 months and for a year, it was really alarming. And truly, we are seeing that now you go to the dialysis centers across the country, each center is taking care of about, let's say, 15 to 20 patients a day. which is really alarming.
With a change of government, many kidney patients are confused about the state of the free dialysis program. Gladys Ahiakpo, who has been battling with kidney disease, urges the new government not to discontinue free dialysis treatment, bemoaning that it will send them to their graves.
Difficult to say one
It is very difficult if you can't urinate and do anything. We are pleading with the government to do something about it for us. We beg the president not to cancel the free dialysis treatment. If there's something called Mahama Care, then we call on the president to come to our aid.
Another patient, Priscilla Kuma, calls on Ghanaians to stop stigmatizing kidney patients and instead offer support.
I have faced a number of stigmatization issues. I used to be plump, but now I have reduced in weight. When people see me, they don't want to come close to me because they feel I have contracted HIV/AIDS.
As we mark World Kidney Today on the theme, "Are your kidneys okay? Detect early, protect kidney health." People like Annan patient Asabia struggling with the crushing cost of kidney. Will the incumbent government continue to fulfill what the previous government started by fulfilling the promise he made to kidney patients as he made kidney and dialysis treatment free? And with Ghana's rising cases of kidney disease and the dire need for accessible care, for kidney patients, this is not just another policy, it is about survival. Andy Opondinchi, reporting for ABC News Ghana Television, Kolebu Teaching Hospital, Renal Unit, Accra.